The Emergency Committee on COVID-19 met to discuss the global situation and the way forward. The committee's view is that COVID-19 remains a public health emergency of international concern, and I agree. The committee emphasized the need to strengthen surveillance and expand access to tests, treatments, and vaccines for those most at risk, and for all countries to update their national preparedness and response plans. While the global situation has obviously improved since the pandemic began, the virus continues to change, and there remain many risks and uncertainties. This pandemic has surprised us before and very well could again.
All of the subvariants of Omicron are showing increased transmissibility and properties of immune escape. With this XBB recombinant, we have one study that is based on a pseudovirus, so not a live virus, that is analyzing antibody escape, and it's showing significant immune evasion. And this is of concern for us because we need to ensure that the vaccines that are in use worldwide remain effective at preventing severe disease and death. And so the more this virus circulates, the more opportunities it has to change. We need to be able to track this virus. There are millions of cases being reported each week, but our surveillance has declined. Testing has declined. Sequencing has declined. And that in turn has limited our ability as an organization with our expert networks around the world to assess these. The Technical Advisory Group for Virus Evolution will continue to discuss these subvariants, and in particular XBB recombinant that you mentioned, as well as many other sublineages that are circulating. But your question about will we see a large number of subvariants circulating in the coming months, that's happening now. So we need to be prepared for this. Countries need to be in a position to conduct surveillance, to deal with increases in cases, and perhaps deal with increases in hospitalizations. We don't see a change in severity yet, and our vaccines remain effective, but we have to remain vigilant.